name is Catherine Porras, and I'm going to do a head-to-toe assessment on a post-surgical patient. Hi, I'm Kathy, and I'll be your nurse today. I'm going to do a full head-to-toe assessment to check how you're doing after surgery. I'm going to close the curtain for privacy, wash my hands, and put on my gloves. Can you verify your name and date of birth?
Jose Andre Porras, May 20th, 1995.
Okay, thank you. So I understand that you had an abdominal surgery yesterday, and I'll start your morning assessment now, and I'll explain everything as I go. And let me know if you feel any pain or discomfort at any point. Sounds good? Okay, so the patient looked alert and oriented. He's sitting upright, he's speaking clearly, and he appears well groomed. And the patient's skin, it looks pink and dry, and I don't see any signs of distress. So now I'm going to check his vitals. His blood pressure is 117/80, heart rate is 90, respiratory rate is 18, temperature is 37.5 Celsius. His oxygen level is 98% on room air. Are you having any pain right now?
No.
Okay, so the patient denies pain. And to make sure that the patient is fully alert, I'm going to ask him questions. What month is it?
July.
Okay, and what city are we in?
Santa Rosa.
Okay, and who is the current president?
Donald Trump.
Okay, so I'm going to start with the head assessment and face. So the patient's head is normocephalic and his facial features are symmetrical. Now I'm going to check his eyes. So please look straight ahead. Okay, so his pupils are equal, round, and reactive to light. The sclera looks clear, and the conjunctiva is moist and healthy. Okay, so now I'll check his ears. Okay, so they appear symmetrical with no redness, swelling, or discharge. Now I'll check his hearing using the whisper test. So I'm going to say a few numbers and please repeat them back to me, okay? 22.
22.
44.
44.
Okay, so great. The patient's hearing seems intact. So I'm going to look at his nose now. Okay. So the external nose looks symmetrical, and the nasal septum is in the middle. The patient's nares are patent bilaterally. So now I also pressed his frontal and maxillary sinuses, and they appear to be fine. And next I'm going to test his olfactory nerve or the sense of smell. Okay. Okay, can you close your eyes? Smell it? Okay, please let me know what it is.
Alcohol.
Okay, perfect. So the patient was able to guess what it was. So now I'm going to proceed with mouth and throat. Okay, so please open your mouth and say ah.
Ah.
One more.
Ah.
And close it. Open again like this. Okay. So his lips and oral mucosa are pink and moist. His teeth are intact and his gums look healthy with no bleeding. The tongue is midline and it moves freely, showing normal function. His uvula rises midline and his soft palate moves evenly. So this tells me the cranial nerves are working properly. So there's no lesions, there's no swelling or redness noted in the throat or the tonsil area. So now I'm going to feel his neck. Can you swallow? Okay, So the trachea is midline, and I feel no swelling or tenderness. The cervical lymph nodes are non-tender, and they're not enlarged. Can you please move your head side to side, then up and down? Okay, so good range of motion. Now, can you shrug your shoulders while apply gentle pressure? Okay, perfect. That's good. So it's good equal strength in his shoulder muscles. So now I'm going to listen to his lungs. And while I listen to it, can you please take a deep breath? Okay. And can you breathe in and out while I listen to your lungs, okay? Okay, so breath sounds are clear in all lobes. So now I'm gonna feel the patient's chest and just making sure that everything is non-tender. Okay, so everything is non-tender after palpating the chest. So his chest also expands evenly and his breathing comfortably with no extra effort. Are you having any coughing today?
No.
Okay, so I'm going to listen to his heart now. Okay, so heart sounds are normal, no murmurs. Okay, so now I'll check his pulses on his neck, wrist, groin, ankles, and feet. Okay, so I'm just gonna pretend that I checked his groin pulses. So they're all +2 bilaterally. And I'll also check how fast his blood is returning to his fingers. Okay, so capillary refill less than 3 seconds. So now I'm going to examine his abdomen. Okay, but first I'm going to look at his incision, and it looks clean, dry, and there's no swelling or discharge. So next I'm going to listen to his abdomen. Please relax. Okay, so bowel sounds present. So now I'll gently press on his abdomen. Okay, so no tenderness, guarding, or masses. When was your last bowel movement?
A few hours ago.
Okay, so are you having any trouble breathing or nausea?
No.
Okay, perfect. So now I'm going to check his arms and legs move. So can you please raise your arms and push and pull against my hands? Okay, great strength. So now I'm going to test his sensation. So I'm going to lightly touch with sharp and dull objects. And I'm going to ask the patient how it feels. Is it sharp or dull?
Sharp.
Okay, what about this?
Dull.
Okay, perfect. Sensation is normal. Do you have any joint pain or stiffness?
No.
Okay, so the patient is alert and oriented ×3. So to person, place, and time. And can you please take your right index finger and touch your nose? Then reach out and touch my finger. Okay, can you do the other hand? Okay, thank you. So, good coordination. And can you walk a few steps for me or just move your legs in bed? Okay, so gait is steady. Reflexes in arms and legs are normal. His Glasgow Coma scale score is 15. So now I'm going to check his skin, hair, and nails. Okay, so his skin is pink, warm, and dry. There's no rashes, no wounds, or there's no pressure ulcers. Okay, and skin turgor is good. No signs of dehydration. And nails are pink and healthy. There's no cracks or there's no clubbing. Hair is full and evenly spread. There's no lumps or tenderness on his scalp. So that completes the assessment. You're doing well post-surgery. So please call your nurse right away if you notice if there's a new or worsening pain, fever, redness, swelling, or drainage at the incision site. If you experience any trouble breathing, not peeing enough, or any signs of dehydration like dry mouth or dark colored urine, drink fluids, take deep breaths often, and ask for help before getting up. Do you have any questions or anything you need right now?
No.
Okay, so great. I'll go ahead and lower the bed and place your call light nearby, and then I'm gonna remove my gloves. I'm gonna wash my hands. I'm gonna go chart everything we did. Thank you.